So I'm on secondment to the Scottish Government from the NHS, and my job is to implement this framework, Maternal and Infant Nutrition Framework 2011. Obviously, over time we've made a few little adaptations to it to include neonatal. But I'm also be talking a little bit today on behalf of some of my other policy colleagues who sit beside me. We work in a team, and they've been working on the maternity framework, the fresh maternity framework, and the neonatal framework. So I'll start off by giving you a little bit of background on what's been happening, what will be happening within that. And really, I'm hoping you'll see how it all fits together. So this is the framework, the maternity and neonatal framework. It's called the Best Start, and it's a 5-year plan, and it really is thought to be quite a landmark publication for Scotland, and really how we're going to look at the future and build on what we've already done, some of the good work in maternity and neonatal services, but really drive it forward where the evidence is going to take it, and also what the needs of the population of Scotland are going to be as well. So the aim of the review really was to have a very good look at choice, quality, safety in maternity and neonatal, and really find out what was best practice and how best to implement that. There's quite a lot of consultation that went around about these frameworks before the actual documents were published, and they've made recommendations and really are ready to drive that forward, really to be able to provide the right care for all women and children in the Scottish context and the context of what's emerged. Things aren't quite the same. Women and babies and their needs are not quite the same. So there are many recommendations that have come out from this review, and here are just a few of them. Continuity of carer in maternity services, very highly valued. Person-centred maternity and neonatal care, really focusing on the family. A multidisciplinary team care because of these complex needs of many of our mothers and of the infants in neonatal care. A safe and a high quality service, but also accessible, knowing that Scotland's quite different. We've got lots of urban areas, but we've also got a fair bit of rural and remote as well, and our many islands. There's still to be a design of the neonatal care model, and there's still some work to do within that. Transport of neonates because of our complexity, and also because we're not particularly a big country. There may be some focus on having areas with really neonatal areas of strong expertise. The infants, small numbers of infants who have very defined needs will be transported to for the best care and to have the best outcomes. And within both, there have to be both maternity and neonatal, remote and rural care competencies. So that could be for midwives working in islands, able to look after women who suddenly become ill, or even just to provide normal antenatal, postnatal care, or for neonates who are suddenly delivered on an island and need the best care at that point before they're transported off the island. So there's a whole range of competencies and complexities within that. To enable us to do this successfully, we're going to require real workforce development and planning to be able to, a real focus on our workforce and a modernising of our workforce to be able to deliver a whole range of competencies, not just clinical care but social care in terms of how we deliver conversations. Our confidence in it is better achieved when we're really competent and knowledgeable. Now, to help us do that, a real simplification and real smooth running of the systems that we use, for instance, IT. IT needs to be good and it needs to fit our purposes, and we need also to have a whole load of range of quality improvement methodologies and things to help us to deliver the care. There are links to the SISCC work that we're doing. This person-centredness enables breastfeeding, there's no doubt. Family-centred care, keeping families together, enable us to provide more kangaroo mother care, expressing and breastfeeding. So obviously when we're delivering these frameworks and before they were finished, I was looking at an eye from how do I best deliver this maternal and infant nutrition framework? How do I input into that? And so were many other people. Transitional care on postnatal wards, keeping mothers and babies together, demedicalising as much the late preterm baby, the baby with some needs, because really it's not just high needs and low needs. There's a whole, it runs in a whole, children fit along a spectrum of needs. UNICEF accreditation. Originally, UNICEF and neonatal didn't exist at the time of the maternal and infant nutrition framework. We've embraced it anyway. We saw it needed to be there, but we've made sure it has links with the SISCC. The postnatal environment being conducive to breastfeeding, very important. How we deliver that care in the future, and how if we're redesigning buildings and we're thinking about how do we make it a comfortable place where you could be confident enough to breastfeed in both the neonatal and the maternity things. So there's next steps. There are priorities for action within both the maternity and neonatal frameworks. The continuity of care, there'll be early adopter boards and those will be announced soon. The person-centred maternity and neonatal and keeping families together, work streams working on how we deliver that. There's a chair for this implementation, it's Jane Grant, and she'll be helping to focus and get us all working towards this implementation. The government policy team are already working hard. The redesign of the maternity services with a focus on local care and multidisciplinary community hubs. There are examples already of good practice and we'll be looking to expand those. The recommendation of the new model of neonatal care and the workforce changes. These are the priorities, and these are big things, huge, but they underpin the whole thing. So lots of work for those frameworks. So let's have a look at the maternal and infant nutrition framework, and this is just a little run through. What I've been trying to do within the team is really strengthen the links with the other policy teams, including the two, but there are many others. There's diet and obesity team, the obesity route map, a whole host of other pieces of work, Healthy Start, our nutrition teams, Food Standards Scotland, the other departments of health, Northern Ireland, and a number of other teams looking at how we can work better together to talk to each other and share. I've been looking at how we plan for sustainability and future proofing of the framework, because it goes to 2021, but how do we make sure all the things that people are doing really can carry on and be sustained and remain in place. We've set very clear evidence-based priorities. So we have looked at the framework and looked at what should be the things we're focusing over in the next few years, and I'll talk about those shortly. And I've been looking at supportive methods of increasing the rate of effectiveness of the implementation. So what are our priorities? The things that are coming up high in evidence. Preconception is the big thing. Lots of things about epigenetics and preventative medicine as well. Promoting optimal preconception planning. Shifting the weight of interventions, particularly for weight, to prior to the first pregnancy. We're a bit concerned with a do no harm scenario, and during and between pregnancies appears to be a little bit difficult. We're not quite sure that we know exactly how to do that or where it's effective as we would like to be. But that doesn't mean we'll let go of good food choices in pregnancy, because it's not just about the mother in her pregnancy eating well. It's about her learning lessons, because she's about to have a child and she's creating a family who need to be fed well, and they're the future. So thinking about those. Breastfeeding is always going to be a priority for me. Of course it's going to, in the evidence base. But we've thought about what are the big issues. And one of them is changing the conversations and how we have them, how the media behaves, how we think about breastfeeding, is a gold standard, but really formula's all right. That's how we're kind of thinking. So one of the launches, Breastfeeding Awareness Week, or Breastfeeding Week, will be in the 19th of June this year, and our headline is Changing the Conversation. We'll be having some tough love and some tough messages, and plus some really supportive things that we'll be doing round about that. We'll be announcing some of the good things that we'll be doing, how we've been trying to support women with some input into peer support, supporting the UNICEF Baby Friendly accreditation processes and some of the funding towards those, and some other surprises that we'll be thinking about how we best support women. We're looking at how we might provide breast pumps and electric breast pump loan schemes, things like that. We're not there with all of those things, so I'm not ready to announce we're going to do them. We're still in the how and where do we get the money, but we're hopeful. Issue number 2 is advertising the formula milk industry. We know that, and we've been working. We've just had Alison Thulis who's trying to bring a bill through. We'll not be giving up on that, and we have some opportunities in the future. We're looking at care packages and accessibility and effectiveness and quality of care, and how as a government, it's not our job, it's the job of health boards and voluntary sectors to provide that, but how do we support them to do that? How do we help them train their staff effectively? What policies can we put in place? How do we analyse that? How well it's working? And fourthly, breastfeeding and how it fits in society. How do we enable women to best understand that and to appreciate how important they are and how important this is in their family? So lots of work. Anne will be talking more about the neonatal standards today, but although they weren't in the original framework, we're incredibly supportive of them and how we fund that. For example, we're funding the neonatal units going through the standards. We're funding their first round through. We're funding places at the UNICEF Neonatal Conference, as well as the General Conference. We'll be funding staff training, train the trainer, and other workshops that staff will need to be able to deliver this. I've got wraps into the baby boxes for kangaroo care. Every mother will get one in the baby box, and for all mothers. Really closeness and comfort and responsive feeding. And so we're working on this breast pump loan scheme. Weaning and toddler diets is our third priority. Not just the age at which we wean, but how do we do that? Making sure that the staff have more information so they can provide skilled support. We know that family mealtime behaviours are really important, so lots of the messaging will be about how we achieve that. Appetite control, portion size, nutritional content. So we'll be going more in depth so women understand not just when to wean, but how to wean, and staff will be able to support that confidently. And finally, one of the big things and big pieces of my work over the last year and a half has been this maternal and infant nutrition survey. So the other countries decided to stand down in the infant feeding survey, but Scotland has gone ahead. It's been a huge amount of work. It's underway at the moment. The first sample, which is the 8 to 12 month sample, is nearly complete. The 8 to 12 week one is just rolling out now, and the antenatal one will follow. These will be very big samples, and we'll be asking a lot of the questions associated with the framework. How well are we doing? What do women think about what we're providing? What are we actually delivering to them? What do they think should be better? And where are we going to go in the future to improve the rate of and the effectiveness of implementation? But all of these frameworks, it's important they all fit together. They're cross-cutting, and we all understand, certainly at government level, we understand how well we fit together and how we can help each other to deliver these things much more effectively. Thank you.
Thank you.